Test, test, test. Test 1, 2. Good.
I thank everyone for being here. We're going to start in just about 2 minutes. Thank you so much, our committee. Thank you.
Delia's bag next to you so she knows. Wonderful. We got to start shifting now.
And Drucker and Lafazan are on their way. Okay.
Well, Drucker is, I think. I don't know what happened. I'm not responsible.
I know. It's hard enough to take care of ourselves.
Especially the first morning after she went to the It was like middle of the night for her.
Good morning, everyone. My name is Legislator Rose Walker, and I'm the chairwoman of the Nassau County Legislative Health Committee. I'm joined here this morning by Legislator James Kennedy, Legislator C. William Gaylor, Legislator Tom McKevitt, Legislator Steve Rhodes, also Legislator Delia DeRiggi-Whitten, who is also on the Health Committee. And okay, we have legislators on their way as we speak. Legislator Deborah Millay, Legislator Minority Leader Kavan Abrams, Legislator Ellen Birnbaum, Legislator Carrie A. Szilagyi, and Legislator Legislator Bino. Thank you so very much for being here and joining this morning. And all legislators will get to speak, even though they might not be on the Health Committee. I want to thank everyone for being here this morning and welcoming those tuning in via live stream on the legislative website. It is my hope that at the conclusion of this hearing, we will have been reassured by members of our community. We have reassured the members of our community that we are fully prepared to do everything we can to contain the spread of this virus and are doing our best to protect our most vulnerable population. That said, as of this morning, there have been 13 confirmed cases of the coronavirus in Nassau County. It is the responsibility of this committee to make sure that Nassau County departments involved with handling this virus have the adequate staffing, resources, procedures, and protocols in place to contain the coronavirus in Nassau County. I have complete faith in our county departments, but felt it was necessary to reach out and offer any assistance needed to obtain the resources they might need to keep our community safe. The legislature is committed to working closely with our colleagues at the federal, state, and local levels to secure any additional resources that might be identified as necessary at this hearing. So I did give a brief hello, but before we continue, I'm going to ask all of you please to rise and we will say the pledge. And Legislator Gaylor, if you would lead us.
Sure. Everybody please face the flag, hand over heart. Join me by saying, I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Please be.
Okay. I believe we'll start right away hearing from our Department of Health.
Good morning. Thank you, Chairperson Walker and all members of the legislature. I am pleased to be here and appreciate the invitation to present to you on the situational update and status regarding our response to novel coronavirus. It changes very rapidly, and one of the challenges we've had since the minute this started is that the guidance we receive, the protocols that have been put in place from the CDC down to the state and down to us have changed dramatically, even to the point where when I walked in the building this morning for this hearing, there were 13 confirmed cases, and now I'm going to share breaking news that it is up to 17 confirmed cases. And so what has happened is, until yesterday, actually, the Wadsworth Laboratory in Albany was the only lab that we were sending tests to, as well as the CDC, but obviously Albany was much closer and so much quicker. And they were getting all the lab tests that were coming in from various counties around the state. As of yesterday, the Northwell Health System has started testing, and so that will get us results much more quickly. And we're starting to see results come rather than one at a time trickling out in batches. So that's how you go from 13 to 17. The batch of tests comes back. It is not a surprise that we are seeing an increased number of results. Very often, we look at the numbers of increasing cases and see it as something that's tragic or disastrous. It is not. It is fully expected at this time. And what I want to do is describe to you the strategy that we've implemented. It is a national strategy. Federal government's doing it, state government's doing it, and local governments are doing it. And I hope to set expectations and keep you informed. The numbers are going to change potentially by the hour. The guidance is going to change potentially by the hour. The definitions of quarantine, who's to be mandatory quarantine versus precautionary, a voluntary quarantine, changed on Friday, and they're likely to change again. And just to go back to the beginning, coronavirus is a respiratory virus. It is cold and flu season. That's a nice way of saying respiratory virus season. And the measures that we take to protect ourselves against all of the other cold and flu viruses, some of which are other types of coronaviruses. Everybody here has been exposed to some kind of coronavirus. They're one of the most common causes of the common cold. The measures work. Hand washing works. It wipes the virus off your hands. So if you touch a surface or you're talking to somebody and you get a little spray on your hand, if you wash your hands before you touch the portals of entry, the eyes, the nose, the mouth, the mucous membranes, you're not going to get sick. And that is why hand washing is such an important and best weapon against respiratory viruses. If you're sitting in a place where there isn't soap and water right there, the alcohol-based sanitizers work very well for this. And anybody who knows me and knows I'm trained in infectious disease, for years, I've been carrying one of these to the point where I think my family thinks I'm a little crazy. But a little OCD right now is not a bad thing for helping you stay healthy, to be quite honest. I have a very short PowerPoint presentation. It's 4 or 5 slides. I'll give you a situational update. The last slide, I think, is the vital concept for you all to understand as we go forward. It's a graph that shows what our efforts are meant to do. So, with that, disease update. We have 17 cases now confirmed in Nassau County. We have, with every case, a full contact investigation is done to see where that person has been, where they have eaten, who they have been in contact with, what social events they've gone to, any other potential exposures. And based on those exposures, we reach out and interview every one of them and make a decision on, is there an exposure? Is there a high-risk exposure, such as would be somebody who's directly in contact with somebody that's been sick? Is there a lower-risk exposure, such as you might have been at the same event as somebody else, but you didn't have immediate close contact with them, that the state is calling proximate contact? And defining that can be a challenge. Very often it's on a case-by-case basis with the State Health Department. We have State Health Department staff now stationed in our county health department. Our command center is working basically around the clock. The calls are coming in around the clock. And before we go any further, the numbers have blossomed in the last couple of days, but my staff has been working on this since the initial voluntary quarantine program began well over a month ago. And at the very beginning of February, we started receiving lists from the CDC as travelers returned from China. And the lists come when the plane lands. Doesn't matter if it's 2 o'clock or 3 o'clock in the morning. And our staff has been working around the clock to make sure that everybody who needed to be put in an isolation away from other members of society has understood that, have received the resources they've needed to do that. And we've kept track. The 14 days 14 days is out of abundance of caution, and the name of this is novel coronavirus, the novel being new. There are a lot of questions science doesn't know. Even myself as an infectious disease doctor, I've been asked, what's the incubation period? It's a brand new disease. There's still only 500 or so cases in the United States as of this morning. You cannot make an epidemiologic understanding on such few cases. The CDC and the World Health Organization now have thousands of cases from around the globe. They're evaluating what data is reliable and what's not. And we're starting to understand better. The reason the quarantines are 14 days is because we don't think the incubation period is longer than that. We think it's less than that, and we're being cautious by making it a 14-day. I could tell you for most coronaviruses, the incubation period is usually somewhere in the 3 to 5 day range. While this novel coronavirus is a coronavirus, it's a different virus than other coronaviruses, so we can't treat it. And that's caused confusion because hospitals sometimes on their normal respiratory panel that they've had for years look for different viruses, and so some people might have seen a coronavirus test in the past that's not novel coronavirus. This is its own unique test. We're happy that Northwell and soon commercial labs will be testing because the key strategy is finding people who have this and isolating them. the number one most important message is if somebody is sick, stay away from everybody else as best as you can. Don't go to work. As we start looking at case reports from across the country and around, when you find people who are sick and you say, okay, where have you been the last 2 days? When did you get sick? Oh, a few days ago. And where have you been? Oh, I've been at work each day. That is the epidemiologist's link right there, that you know that all those people now that were exposed have to become potentially quarantined in this case, or they're potentially contacts. So staying home. We just had a meeting with clergy. Vital. It appears so far, and this is brand new, this could all change, but it appears so far that the elderly and immune-compromised population is particularly hit with this. While that's not good news, it is appearing, and it's very early, and I'm praying that this holds true, that children seem to be on the milder end of the disease spectrum. And that's a nice change from flu, where this year we had a very difficult flu season. There were 9 so far. It's still on, but it's starting to wane. There have been 9 pediatric deaths in the state of New York from flu this year. So far, we don't hear that from novel coronavirus, and that would be, if that holds to be true, that would be very important, positive part of the story. We have 17 cases. As of this morning, we had 40 people in the county under mandatory quarantine. That number is going to dramatically rise as our team right now is evaluating the new cases. 6 of the cases, so when I walked in today, I knew of 7 confirmed cases and got one. 6 of the 7 were linked together. So that's the kind of understanding that's helpful, that we know it's contained basically, and we know where it came from and what the path is, and then it doesn't surprise you after you do the history when people test positive, because we know they had the exposure and they have symptoms. It makes sense. So we know there's going to be more positives. It makes sense. The cases since those literally happened after I walked in, so I won't be able to answer them. I haven't seen the charts yet, but my staff right now, a war room over at the health department, is working diligently on tracing every one of those cases, where they've been, where they are, where they work. Just because somebody works somewhere doesn't mean they were there while they were sick. And so I think it's important that we don't panic if you hear that somebody works somewhere. We're going to evaluate the work exposure and let the workplace and whoever's appropriate know for whatever exposures exist. We have worked very closely with the State Health Department. The CDC guidance is coming out generally daily or more frequently than that. And so those are some of the basic points about what we know about the disease. We don't have a mortality rate. I could tell you that clearly we see things where senior at-risk populations are hit the hardest with regard to fatalities. There was this situation that occurred in a nursing home in Washington State where there were 4 deaths among patients there. So out of 500 known cases, those were 4 of the deaths. It skews the data and the mortality rate, but I think that the lesson there was learned and heard by our nursing homes here in New York and New York State, Nassau County. Following the Westchester exposure, New Rochelle nursing homes, where the index case in that outbreak is the original case, have ceased visiting hours, and I think that nursing homes are under state jurisdiction as Article 28 licensed facilities, but I think many of them are taking precautions and limiting exposure. As far as the general public, I've been asked a lot, is it time to close schools? Is it time to stop events? It really is going to be, as this expands, something that we evaluate, and I'm going to talk about the process in the presentation shortly. I don't want anybody to panic. There are many, many thousands of flu cases that go around, and we don't stop events. But we also have to be smart. We have to rely on the public to stay away if they're sick, to keep children who are sick away from their grandparents and more elderly at-risk people. And we need to look at specific events. Knowing the risk is to the senior population, while we haven't yet had an outbreak in a community that might make me say maybe senior events shouldn't happen. That might change today. I haven't evaluated the new cases that came in today. And that's where a high risk would be. Speaking with the clergy was vital, because I know at my synagogue and a lot of the other religious places I've been, a senior population is the daily maintenance group that maintains the houses of worship. And there's a lot of handshaking and a lot of hugging, and that could be deadly right now. And so it was great to get the clergy on board with doing, one of the religious leaders upstairs said they did the holy bump this weekend, where nobody actually touched each other, but they touched elbows. Things like that are vital. They're life-saving measures. You can't count how many lives are saved by it, but it definitely helps. Financial costs to date. So thankfully, the governor has declared a state of emergency, meaning that the health department will be reimbursed for much of the expenses. I know how that impacts the health department. I don't know about other county agencies, but I'm sure Commissioner Morelli can talk about that. I can share with you that we started monitoring in early February. February 2nd was the official monitoring start. We were doing work before then. But in February, our overtime costs, I know many of you have called my office and asked this, the overtime costs for February, this is overtime, supplies, travel to bring quarantine materials and all of that. The extra cost for February, before we had any cases, came to about $92,000. We do have an emergency preparedness grant that will cover it. There are state appropriations by the governor that will help, and this declaration of emergency will make a lot of our expenses reimbursable, and our fiscal teams are working on that. I know that's a concern. So when we deal with disease, there are different kinds of interventions. Pharmaceutical interventions we actually have for the flu. We have vaccine. We have medication that does help with the flu. It doesn't cure it, but it does decrease the illness. Unfortunately, with novel coronavirus, all we have is symptomatic treatment. If you're sick with it, it's like the way we get a cold. You take medicine to make yourself feel better, but as of now, it has to run its course. For those who are more seriously ill, they might require a higher level of medical treatment, as bad as being on a respirator, and some people there have been fatalities. I don't know what the fatality rate is going to be. It's one of the most important indicators of trying to predict for you what the impact is going to be on the county. Estimates of what has been reported are in between, I've seen different numbers, about 2%, about 3% of all the people who get it are fatalities. However, many people may get it and have no symptoms or mild symptoms, so they're not counted in the math. So if we knew all of those, the denominator in the math may be higher and the fatality rate may come down. Also, United States has top-of-the-line supportive care so that people who have been exposed are more likely to get treatment here than in a place that doesn't have this kinds of supportive care. So what we can do, and this is every resident and all of you as elected leaders, non-pharmaceutical interventions. The CDC and the health department and the state health department all have what's called a pandemic flu plan. It's called a pandemic flu plan because historically, influenza is the most likely emerging respiratory virus to mutate and cause a mass event. But the coronavirus as a respiratory virus fits in under the plan. The mass flu plan is for all and any potential respiratory viruses. So we've activated ours. The CDC has a wonderful flu plan. It's on their website. By the way, their website is the main source of breaking news for this, cdc.gov. It is excellent. You click on the Corona banner, and there's categories for anything you might want. Information for healthcare providers, for elected officials, for schools, for social organizations. There's great categories. It's nice. So, what is a non-pharmaceutical intervention? The goal is to reduce the societal impact of a pandemic. I want to set our expectations. The goal is not zero. That is not realistic on a viral outbreak in a community where there is no immunity whatsoever in the population. So our goal is to minimize disease, make it as few as possible. I'm hopeful that while I reported to you today there are 17 new cases, because of our efforts, the number is not higher than that. And there's no way to count what the number would have been without our efforts. But our efforts of isolating people have been thorough and have been helpful. And I do believe that although I have 17 reported cases, and there's going to be more, that the number that we see is much less than what it would be without our efforts. Non-pharmaceutical interventions are written for pandemic flu, but they apply to all respiratory illnesses. These are actions that people and communities can take to help slow the spread of virus. They're most readily available interventions to slow transmission, and I'm going to show you examples of them, and they can be phased in or layered. So, washing hands is an initial phase. We should be doing it anyway, even if there is no, but that's an initial layer example of a non-pharmaceutical intervention. Quarantining people would be a next layer. Canceling events or closing down facilities would be a next layer. And so it's stepwise that we take these actions, but also based on what's happening in a community. If there's one community or school district or event that's particularly hard hit, you might close one place or one school, but not all of the schools in the county. And this is what we're here to help assess and provide guidance on. Could you take this and tell him I'm in front of the legislature? Examples. What are non-pharmaceutical interventions? These are just examples. Some people do some of them. Some people do none of them. But the more we can do in society, the better the results would be. Personal measures. We really need our residents to help us with this. The spread of disease goes from people who are sick to people who are not sick. So we're asking everybody to do their part. Hand hygiene, washing hands, using sanitizer. If you sneeze in your hand, wash it before you touch anybody or anything. Respiratory etiquette, cover the sneeze. Don't touch your face, because if you do happen to get virus on your hand from a sneeze or touching something, virus on your hand isn't going to get you sick. It's when you scratch your nose or your eye or your mouth that the virus gets it into your mucous membranes. Isolating sick individuals is what we are working very hard on. These people who are confirmed are going to be mandatory quarantined. And by mandatory, there will be legal consequences if people violate it, and we are checking them. We are going to their homes for every positive case and checking that they are not violating the quarantine. And a mandatory quarantine is hand-presented. It's a legally binding order, and people who violate a mandatory quarantine will be locked in isolation. They will. We've done it before. If we have to, we will. That's what we have to do to protect the community. But please, stay home if you're sick. Stay home if you're sick. And if you're not worried about other people, think about your own family members, okay? Children with a cold can give it to a grandparent. The child will be fine in 2 days, and the grandparent may die from this. I'm not going to sugarcoat this. We need to understand what we're dealing with here. That's what we're seeing, that seniors and immune-compromised are much more likely to do poorly with this at this point. So please stay home if you're sick, and isolating sick individuals is important. Social distancing in some places and some companies in the state of Washington, which has been particularly hard hit early on, are working from home when indicated, and avoid high-risk situations. So probably there are certain events that people who are immune suppressed should avoid. If there's going to be a birthday party of a lot of little kids and there's viruses going around the community, not a good time to attend that one. People don't like to hear that, but it could be a life-saving measure. Things like personal protective measures, masks on sick individuals. Now, this is important. The wording is very vital. Masks on sick individuals. The masks are not indicated by the CDC on healthy individuals. The masks do not prevent healthy individuals from obtaining the virus. Their eyes are mucous membranes that are very high entry points for virus. They're still wide open. The masks on sick individuals can catch a lot of the droplets going out. So the masks would go on sick individuals if they're around others. Hopefully they're in isolation and they're not. But if they need to be transported, if they, for whatever reason, first learning about it, the masks are for sick individuals, and we really don't want the public hoarding masks. I know yesterday we had a press conference that Commissioner Morelli was at with me, where people were selling masks online for like $100 for 12 masks or something crazy that normally costs 30 cents or something ridiculous like that. I'm exaggerating, but not by that much. So we want We want our healthcare providers to have access to the equipment that they need. We don't want the supply chain to dry up. And remember, our healthcare providers are dealing with this, but all the other routine diseases are still here. They're still dealing with normal pneumonias and normal other viruses and heart attacks and cancers and all the things. We want our healthcare providers to have the resources. So we want to make sure people aren't just using masks because they think it's the right thing to do when it's not indicated and it's not right. Environmental, right now, most of the guidance is for standard cleaning of facilities. We know the virus is not particularly hardy once it comes out of the body. We don't know how long it lives on surfaces. And even if it does live on surface, we don't know if it stays a viable transmitter from a surface. But standard cleaning measures is currently recognized by the CDC. And if it escalated more, which you're starting to see in other parts of the world, like in Italy, where a part of the country has been quarantined, things like school closures, community quarantines, and event cancellations may occur. We have 17 cases now. The number is growing. We have well over 1 million residents, close to 1.4 million residents. You are much more likely today to encounter flu than you are this. I want us to continue going about our lives, but using common sense. And so people who are sick should not be out in the public. People who are at higher risk may want to avoid larger scale events starting now because we're starting to see the numbers go up. The guidance on this is going to change, but for the average person, if they take standard precautions, they should still be going about their lives. We're not just going to shut down society now for this. This may change. The guidance on this can change dramatically, and we will be here to guide you and schools and agencies and whatever events there are, but we're not in this alone. Westchester recently has had a lot of cases. I think I saw they were in the 80s this morning, if I read correctly. Some schools have closed, some nursing homes.
Dr. Eisenstein, I don't want to interrupt you,
Yeah.
but you need to take a phone call at this moment. If we could have someone fill
Okay.
in for you at the moment.
Let me, okay.
I don't want to make anyone nervous, but you should take this phone call. Maybe we'll let, how
Okay.
about Commissioner Morelli?
Okay. Yeah, we'll turn it over to Commissioner Morelli. And the last thing I want to do, which I'll do after this call, is this graph shows what we're trying to achieve. This is your strategy. This is our strategy. The purple is what happens without these interventions. The striped curve is what we try to achieve with these interventions. We're not trying to achieve zero. We're trying to minimize it. And I will, hello there. And I will, I apologize.
No, don't you worry. Okay, you're on, Mr. Morelli. Thank you.
Good morning, and thank you, Chairwoman Walker, for having me, and thank you to everybody on the legislature for inviting me here this morning. For those of you who don't know me, my name is Stephen Morelli. I'm the Commissioner with the Office of Emergency Management for Nassau County. For those of you who don't know what we do, when there's an emergency, we're out there managing it. And we're doing the best we can, particularly with this problem that we're dealing with here in Nassau County. And the last thing we want is for anyone to get nervous and to panic, and want everyone to understand that we are we're on top of this. Just to give you a little bit of background here, the Office of Emergency Management largely sits in support of all the other agencies, whether it's the police department or any law enforcement, whether it's our fire marshal and the volunteer fire service, our volunteer ambulance corps, the Department of Health, and a lot of other county organizations and county agencies that rely on particular assistance that we are able to give. What are we doing here at the Office of Emergency Management for this particular problem is that our Emergency Operations Center, which is a central location within our facility, has been open since 9 a.m. yesterday. It's going to be open from 9 a.m. to 9 p.m. Going forward every day, so there'll always be somebody in the office. Actually, during the week, it will be open till 11 p.m. as we do have staff there. The objective in that office is that we have representation from the Nassau County Police, from the Nassau County Fire Marshal. We would like to have someone from the Health Department, but I can attest to it. I was there over the weekend. They're at wit's end over at the Health Department. There's a lot going on, and they're working very hard. We have people from the MTA there, as transportation hubs are also a large area where people are in close proximity to one another, as well as my staff. Our objective is to be able to field information from all the agencies that are out there requesting assistance, to be able to keep an eye on our hospitals and healthcare facilities to see if we see a spike in admissions or a spike in emergency room visits, or even visits, people going to urgent cares or to their own doctors. We receive a lot of phone calls from the general public, and we're happy to answer every phone call requesting some information. As Dr. Eisenstein had pointed out, we try to give them, the first thing we want to do is to calm everybody down. The offer that we give them is to follow the Department of Health's guidelines, as well as to go to cdc.gov, which is where pretty much everybody's getting their information regarding this coronavirus. Excuse me. We've begun collecting a lot of information from a lot of the hospitals. They're doing the best they can, but it won't be long before everybody is taxed, because the panic is there, and people have to understand, as Dr. Eisenstein and as the county executive have made the point to everybody, is if you're not feeling well, stay home. Don't go to the emergency room and don't go to your doctor. Call. They will give you the guidance that you need. The health department has been working extremely diligently, getting the information to people, bringing thermometers out to them, and making sure that we're monitoring those that need to be monitored. One of our biggest concerns is keeping government up and running. We want to make sure that, number one, that everybody in the legislature, as well as every other county agency and county department, is protected. We want to make sure that the public knows that no matter what, the county government is there. Whether it be the legislature, whether it be any other department, we will be there to make sure that our residents get the care and the attention that they require. In doing so, the Office of Emergency Management has requested from every county department a continuity of operations plan. We want to know what's going to happen should there be a problem with any of you being able to get into your offices or buildings, being able to access any of the information that is imperative for you to be able to manage your constituency. The legislature hasn't received those documents yet. Not that we don't want to give it to you, but these are documents that actually went out about a year ago. We want to make sure that we're able to collate these, get all the information, so you as well will have the information and the ability to continue to function should there be an issue where you are unable to access your offices. Nassau County departments have been kind enough. They're forwarding to my office, so we're able to collate them. We're going to review each one of them as we receive them to make sure that they're complete and to make sure everybody's on the same page. As of 10:30 Sunday morning, we requested through New York Response. Now, New York Response is a portal that we use to go through New York State to request additional resources. We've requested 100,000 N95 masks, 100,000 gloves, rubber gloves, and 25,000 isolation kits. That's not to say that the panic is there, that we're going to need all those. We need to be prepared. One of the problems has been that the federal government has come right in and told, whether it's 3M, Kimberly-Clark, Condor, any of the other manufacturers, do not sell to the public. And it's not that they're doing that to spite everybody. The objective is to make sure that healthcare providers and first responders have the supplies that they need. I've been to the supermarket and I'm watching people wearing masks. Costco, you saw the mad run on toilet tissue and paper towels, and I don't know how that's going to fix the novel coronavirus, but at least everybody will be able to have the supplies that they need. We have, at the present time, dispensed approximately 17,000 N95 masks, excuse me, and 7,500 gloves to law enforcement and to some in the first response community. Nassau County OEM at the moment has 80,000 N95 masks on hand, 90,000 surgical masks, and approximately 30,000 gloves. And at the moment, they are reserved for hospital use and for our EMS providers. A request was made from New York State for us to hold our supplies in the event we have to replenish hospitals that have depleted their supplies due to the increased usage. So we've been doing the best we can in providing stopgap measures should some hospitals be in a position where they're going to need them. To single them out, surgical masks are also a priority. Again, it's to put on the sick that as they enter the rooms. Thank you so much. As they enter the emergency rooms or into the doctor's offices and whatnot. What is wrong with me? I'm sorry, excuse me. I heard uh-oh. There's no uh-oh here. Feelings hurt. I'm over it. What we also have done is we provided to the Nassau County Police and the Nassau County Emergency Ambulance Bureau additional supplies because they're the ones that are entering every request for assistance. You have no idea once you get inside there whether it's someone who's got this virus, whether it's someone who has some other illness or nothing at all. But we need to make sure that the people that are providing the care have also provided with the protection. New York State has implied to our office that in order for us to replenish supplies, they were not giving to any OEMs statewide. They were not going to be replenishing supplies. They have further clarified that in saying they will replenish that which we go through. So as I said, we've made a very large request. We will be requesting more. Once we make those requests and we're assured that we will see delivery, we're going to deliver out to the Volunteer Fire Service. Been receiving a lot of calls from a lot of fire departments and a lot of ambulance corps that are requesting additional supplies. Once we know the supplies are going to be coming in, we will make it. We've actually put together a system where we will be distributing them to the Volunteer Fire Service. Again, they're all volunteers. A lot of them are young men and women, and we want to make sure that everybody's protected because they're the ones that we're counting on also. Cost measure-wise, the Office of Emergency Management is largely grant funded, and we keep a pretty tight budget, but we do make some assurances for this, some allowances for this. We're not burning through it quickly, but it's going to happen. So what we're in the process of doing is to maintain adequate records of our equipment, of our time and leave usage, and we're making sure that once reimbursement through the federal government becomes available, we're going to apply for it as everybody else will. With the declaration of the state of emergency does allow that latitude, so we're assuming that while it's not going to be a week from Friday, that we will be able to make the requests and get reimbursed as we need to. At the moment, our office staff is in every morning at 7 a.m. The Emergency Operations Center will be stand up at 9 a.m. every morning, and we'll be closing about 9 p.m. every evening. We do have staff in the office until about 11 p.m. every night, so should there be any problems or any issues, there's always somebody there to answer the phone. Now, a 24-hour number is always manned, so should anybody have any questions, we're happy to answer them. I thank you very much for having me.
Dr. Eisenstein, do you want to jump back in?
Sure. I didn't win the lottery.
Oh.
I thought maybe. So I just want to jump back in. This is the last slide, and I'll be quick, and then we can get to whatever your questions are. And I do want to also say, I pride myself on being responsive to you. I've known many of you a lot of years, and I know many of you have called, and it's been more delayed than you're used to from us getting back to you, but we literally are getting hundreds of texts and emails sometimes by the hour, so I apologize. No disrespect's ever meant. We're just doing the best we can to get through This is about prioritization. We're prioritizing the most important life-saving measures, and our team is doing a great job. And again, I have to thank my team who've worked around the clock, weekends, nights, holidays. It's not been easy. It's frustrating when you do all the work and then, the number can add, and we know that's going to happen. So I just want to thank them. So again, this is the goal of all of these strategies. And this is from the CDC pandemic flu plan. I borrowed it out of a New York State a health department presentation, and I love this slide. I thought it really describes in a way that everybody could understand what it is we're trying to achieve here. We would love to have 0 cases. That's not realistic. It's already not realistic. But the measures that we can take can dramatically lower the number of cases, which will dramatically save lives. And if you look at the bullet points, the measures that we're taking delay exponential growth. Lowers the number of cases, but as you see, the striped graph extends out a little further. It does add time to this, but we see that as beneficial. It gives us the time for science to create a vaccine or test a medication or come up with a new information to help us put an end to this. Also, as of last week, the governor announced that there are 15,000 people in New York State hospital beds currently with influenza. Those beds are going to be vital for capacity if the numbers keeps expanding. And we had a very difficult flu season, but numerically, it's just about starting to drop in a dramatic fashion. Freeing up even half of those 15,000 beds in the next few weeks will create a vital capacity. So everything we do to slow this down helps us protect the public, and that's all the measures that we talked about before. In neither of these curves is the total number of cases zero, but very important for our public, in both cases, they reach an end. And that's the better days. This will end at some point. We don't know if it's seasonal. We don't. We don't know if it's going to burn out the way other viruses have, where they run their course. We don't know if this is going to become just another routine circulating virus like the many others that we have. It's too early to tell, but I believe that with our efforts and with the help of everybody, yourselves and all of our residents, that we could get as close to the striped curve from the purple curve as possible. And we've already brought down that purple curve with our isolation measures. So I think I'll stop there and turn it back to you, Madam Chairperson.
Thank you so much, both you and Mr. Morelli, for your presentations. And we want to all thank you so much for the hard work and the dedication you've given to this before it even became, was brought up to this level, and as you continue to do it now. I'm sure you pretty much have sleepless nights at this point in time, and you're looking pretty good for not much sleep, so, but we want to thank you so much for that.
Thank you.
And for, trying to keep us as much well-informed as you possibly can. I have a tremendous concern for our fire service, so I was very happy to hear that whatever we can do to help them, because obviously they are all volunteers and just working on the budgets that they have in their local communities, some with very small numbers of budgets, and they are out there all the time. Our first responders, sadly, people call our fire department for things that really aren't even emergencies, but they never know what they're walking into. And, we want to make sure they're provided with the necessary equipment they need to keep themselves safe, because then they're coming back into their homes, back into their communities, and we don't want anything to be, for them to be infected and then spread it even more along there.
Well, one of our concerns is also the first responders and the actual response modes that they take. When somebody was to call to say they're not feeling good or whatever, the Nassau County Fire Commission and FireCom is they're doing a robust question and answer session with the folks on the phone. The Police Communication Bureau also doing a pretty good question and answer session. They want to know if someone's going to come up as what they call a fever travel call, someone who fits the criteria of someone that may be exposed or may have been exposed in some manner. What we want to do is to let them know before the first responders arrive that there's universal precautions to be taken and that they need to limit the number of people that are going to be making contact. I also sit on the Regional EMS Council. It was a topic of discussion at our last meeting. Some of the issues there are exactly that: response, access to supplies and equipment, and particular points of transportation for these patients. I can promise you, while we don't have anything written in ink right now, the processes that they have to go through are. So at the moment, someone calls for an ambulance or someone requests some assistance, they're going to get the question and answer session. They're going to get the best possible care at this moment, and the first responders are going to get the best possible advice.
Okay, and Dr. Eisenstein, you had spoken about mandatory quarantines. What if we have someone on a voluntary quarantine? Are those people checked? Are those people checked upon, or?
So
we just hope for the
the
best
voluntary quarantine parameters have changed. They were being checked upon. Now, as we're prioritizing our resources and we expect to have many people under mandatory quarantine, we will give them the same instruction, the same understanding. And let me be clear, it's a voluntary quarantine. The governor talked about that we need people to do the right thing, but we will spot check, not daily the way we are. With the mandatory quarantine, we're checking temperatures, we're checking symptom checks, we're going physically to make sure they're in their home. With voluntary, we will do spot checks. And voluntary, if we hear or see somebody violating a voluntary quarantine, we will then serve them with a mandatory quarantine order because they chose not to participate in the voluntary. Then they're legally on notice. So it's almost like a warning shot. And I want to be clear, the voluntary quarantine category is considered low risk. So we have monitored about 150 people. When the voluntary program started, it was anybody coming back from mainland China. We were monitoring them. Not one of them got sick out of 150, and most of them have completed the 14 days already. But and the numbers coming in from China are much, much less than they originally were. But so the voluntary quarantine we take equally seriously, but we're not doing a daily temperature check and a daily making sure they're in their house kind of thing. However, if they don't abide by it, then they will be served a mandatory quarantine order, which is, like I said, legally binding, and we will take whatever action we have to, because mandatory quarantine is considered a higher risk.
Up to this date, everyone who's been on a mandatory quarantine has been following orders.
Yes, this process just started over the weekend.
Okay.
So.
Okay. I do have other questions, but Legislator Dirigi-Whitten?
Thank you. I just real quick, there might be a couple questions that you don't know, so I don't want to put you on
Sure.
the spot. So I understand that it's still early. When we're just talking about travel, are you recommending anyone who travels out of the country some schools are saying anyone who travels out of the country should have mandatory or voluntary
When they return?
for 2 weeks.
Well, there's different CDC categories. This is based on the federal government. And so the CDC updates its travel log every day. We have cruise ships that are coming back from the Caribbean that are not going under a 14-day quarantine. We had others where people were sick that the boat's not even being allowed to dock. So what I can tell you is the 5 countries that are listed as high-risk travel as of today, and this could change before we walk out, it literally changes that quick, are subject to a quarantine when they return. If they are sick during the travel, they are a mandatory quarantine, and if they return, like a bunch of college students arrive back from Italy, for example, if they're well, they are a voluntary quarantine. During voluntary quarantine, one of the most important things is we instruct them what to do if they get sick. That's the key thing. We don't want them, oh, now I'm sick, I think it's coronavirus, I'm going to go on down to the local emergency room. And in the meanwhile, they can infect the whole emergency room. Right. So the key thing about these quarantines, voluntary and mandatory, is we give them instructions what to do. And if they become sick, we help them with a safe transport if necessary, or maybe we swab them right where they are if it's just a mild cold, they don't need to go to a hospital for that. We don't want hospital exposures. So the answer is the protocol right now is those 5 countries that are on the alert. If you need, I can name them if you want.
I know China.
It's China, Japan, South Korea, Italy, and Iran. But that could change, and we know that it's starting to expand to other places. But when people are coming back from those countries, if they're well, they should go into a voluntary quarantine, and they're told that upon entry into the country. If they're sick at any point, they immediately become a mandatory quarantine.
But as of right now, other than those 5 countries?
I don't believe so.
Okay.
But the protocol,
I
like I said, changing every few hours.
I understand that everything is subject to change.
But common sense should also be used. So if somebody was in a different country where there's disease and they were exposed to somebody who has it, they automatically are mandatory. So if you were in, I don't know, France has some cases. If you were in France and you were around family there who have confirmed coronavirus, you should be into a mandatory quarantine. Okay. So it's about exposure.
All right, now humor me on a couple of these because I get questions. And it's part of our job to answer them. But
yeah.
All right, so from what I'm understanding, this is not an airborne virus. It's something that basically is on a surface and we touch a surface and then
No, so the CDC is debating whether to call it respiratory or droplet. It is in droplets. So the radius of droplets, it's a heavy virus comparatively. So 6 feet, when you're speaking and, or you sneeze or whatever, it's about a 6 feet radius before gravity pulls it down to the ground. So if you're having a close discussion with somebody, yes, you can spray it right into them. But airborne is slightly different So for example, measles, if this were measles and somebody in here had it, the whole room would be exposed.
Okay.
But if this were coronavirus and I had it, people in the back of the room are not exposed. So
Okay.
that's why you have to, when I say it's a case-by-case basis, our investigators are literally like measuring, distances to determine, but we're always on the cautious side.
All right, again, if you don't know, it's fine, but can it live on fabrics as well? So should we take extra precaution with washing our clothes?
Okay,
as far as
so,
using bleach or-
so now if you sneeze and it's wet for a little while, yes, fabrics typically don't support viruses. Porous surfaces, cardboard, paper, but obviously if there's a large amount of virus because you sneezed right into a tissue, a wet tissue could be potentially transmissible. We honestly don't know how long it lives on surfaces. And then the second question is, just because it's living on a surface, is it still transmissible of disease? And so the best thing to do is wash your hands and you don't have to worry about
Two
it.
more questions, and
Okay.
I know, but again, these are from constituents. Is the temperature influencing it? For
We
instance,
don't
like-
know.
Okay, so you don't know if it can survive in the cold or the hot?
Don't know. Is summer going to chase it away? We don't know. People think that because that flu typically is a
flu,
winter
right.
thing. But I remind you, H1N1 started in April and ran through the summer. So
Okay.
I'm not going to predict Mother Nature. No way.
Okay, and is there a difference between washing your hands with regular soap and antibacterial soap?
Antibacterial soap kills bacteria. This is a virus, but both will work on viruses and bacteria. And it's the rubbing action that is the key thing. So if you find yourself in the unpleasant experience where there's a sink and there's no soap, rubbing with water is still better than doing nothing because it's the friction of the rubbing. Now, having a detergent helps the virus and the bacteria, cell walls be destroyed, et cetera, and it works. But it's the friction of the rubbing, which is why we say 20 seconds of rubbing really helps. But any soap will do.
Okay, so there's really no preference, antibacterial or ivory?
I would use either.
Okay, and the last question I have, to update our constituents, would, as you mentioned before, would probably be the cdc.gov would be the best way to.
Yes, and there is New York State has we have a call center during 9 to 5, 7 days a week, but State Health Department has opened a 24-hour coronavirus hotline being staffed by coronavirus-trained people. So being that they're open 24 hours, I think it's a good place to start. The number, if you want to pass it along.
So the Nassau County call center number is 516-227-9570. Again, 7 days a week, 9 to 5. New York State call center, I was told it's 24 hours now. I haven't confirmed that. It's
It
188.
is. I've confirmed it.
188-364-3065.
Okay,
One more time? New York State, 188-364-3065. Nassau County, 516-227-9570.
all right, and I also extend my appreciation.
Thank
I know
you.
it's a fine balance from panicking
Yeah.
and just being cautious, and,
Yeah.
you don't want to give anyone the wrong advice, but.
Yeah. And the truth is, the guidance that we give is going to be a best guess based on the evidence that we have. And I'm going to err on the side of caution, but not the side of panic. That we don't want to panic. We don't stop life because it's flu season, but we do take precautions. And that's what we're recommending currently.
Thank you.
Legislator Steve Rhodes?
Thank you, Madam Chairwoman. I do notice that when you speak about not touching your face, as soon as you started mentioning that,
Yes.
my face became so incredibly itchy.
Yeah,
I
But that's why I keep this, because if you keep using this, you can touch your face. You're not putting anything in. I don't know if you saw there was an elected official who said, "Don't touch your face," and then licked the page to turn it right after saying that. And I said, "Oh."
Which leads me to the next question, because obviously hand sanitizer has become in extremely short supply.
Yeah.
You mentioned hand washing. Are there any other, for the average person, are there any other things that they can go about doing in their daily life to assist in sanitizing surfaces or sanitizing themselves?
Well, the standard cleaning of surfaces now, on surfaces, it appears that this is kind of a puny virus, and the CDC is recommending standard cleaning. You don't need a high-level bleach or anything like that. So some facilities have called and said, we want to buy a super cleaner. What is that? No, don't make yourself crazy. Just do standard cleaning, but do it well and do it thoroughly. And I know if I'm going to the supermarket or BJ's, whatever, I'm going to wipe down the bar with a wipe, as best I have. This is very helpful, these bottles. And I think for all of us are going to have some community exposure. It's impossible to always wash your hands and always not touch your face. We don't even realize we do it. I know I fix my glasses and touch my face doing that probably 10 times an hour, 15 times an hour. But if we're more cognizant of it, I drive my kids nuts with the don't touch your face. I think I'm crazy. Don't touch your face. Don't touch your face. And come on, what are you talking about? I got an itch. Yeah, well, it'll be okay. No, we do the best we can. Do the best you can. Sanitize surfaces normally. The key thing here is people who are at risk, just keep them away from people who are sick. That is the single most important thing. This isn't going to be spread much on surfaces. Of the first 7 cases we had, 6 of them are all interrelated. I knew cases 2, 3, 4, 5, and 6, or some of them, were going to be positive based on the history and the exposures and the symptoms. I knew it. But there wasn't outside of that a lot of cases, none outside of that connected to that within that community, so to speak. So it really is limiting exposure and people who are sick, keeping them away. And wash hands, and even when there's no soap, just plain water is better than nothing. It's not 100%, but rubbing for a while under warm water is better than nothing. The friction helps. It's not going to be the same as with soap, but it's better than nothing.
Thanks, Commissioner.
Yes, thank you.
I too have a couple of constituent
Sure.
questions, which I'm just going to
Go ahead.
to summarize. I know you touched upon hospital visiting hours, and I believe that at this point in time, it is voluntary as to whether hospitals will wind up limiting their visiting hours, or nursing homes, those types of facilities. Is there a point in time, and I imagine it would be done by the state, not by us.
Correct.
Is there a point in time where there would be a consideration of mandatory limit in terms of visiting hours?
I think so. For hospitals and nursing homes, that will be from the state. Interesting, because I know somebody's going to ask about it. With schools, that decision is made on an individual school superintendent basis. And, it's one thing in New York City where there's one public school system and the leaders can make a decision, but we will provide information and guidance. Schools are under the jurisdiction of the State Education Department, but we're in contact with them. I met with the superintendents to tell them the resources we can provide. We're willing to analyze exposures. If there are kids out of school, we'll let them know. If there are staff that have created risk, we'll let them know and potentially make a recommendation. But all schools and school districts are going to make their own determination of what to do. We saw that, and that's for public schools and universities. You saw last night Hofstra canceled classes for this week. I don't know if anybody was aware of that. So that raised the question. I got a call from a couple of other colleges, should we be doing the same thing? And I said, well, they based that on a circumstance. They evaluated risk, and I think that's what's got to happen, and the health department can help with that. But at the end of the day, the hospitals are going to be in consultation with the state health department, state education, and us. When there are cases in the hospital, we're still going to be involved. Thankfully, so far, none of our cases of the first group of 7 was critically ill. I think that's very important, and we wish them well. They're not criminals. It's not a crime to get sick. We want to. So that's. But do I think things like visiting hours, et cetera, are going to start to be shortened in hospitals? I think it makes sense at some point. We don't want sick people. When people want to go visit loved ones, they'll go even if they've got a sniffle, and that could be very dangerous in a hospital or in a senior center. And I thought closing the nursing homes to visitors in New Rochelle in the middle of that outbreak, I thought was a very wise move, but I don't know whose decision it was. So.
Okay. With respect to private industry, and the question was specifically raised with respect to supermarkets, but I guess it has a much wider application to that.
Yeah.
Do we issue protocols for private industry as far as how they should be sanitizing things like shopping carts or things that people would touch on a regular basis?
So The answer is we issue guidance. It's not a legally binding guidance. The guidance from the CDC right now is for standard sanitization, the way that you normally would do it. Supermarkets, which are of a concern, because even during when people are not going out much, even when they're limiting, they still got to get food. Supermarkets are under state jurisdiction, under the Department of Agriculture and Markets, and we will be reaching out to them to make sure the messaging of sanitizing is happening. And I think it's an important point that we'll take back.
Yeah, and one of the other things that was mentioned specifically, I just touched my face again.
That's all right.
One of the things that was mentioned specifically, for example, is when you go into the produce aisle and you pick up you know, a melon or an orange or an apple, and you're checking the apple, you could have, you know, a dozen people have touched that same apple that they're going to turn around and put into your mouth. I mean, are there any kind of
So you know,
recommendations?
Yeah, it's funny. As an infectious disease person, as an infectious disease person, I cringe when I've got to go in to buy fruits and vegetables because I wonder that. But the answer is you should be washing the fruit anyway. This is just one thing, but I got to tell you, there's any number of foodborne viruses, whether it's hepatitis or bacteria like Salmonella and E. coli. Anybody who buys apples or melons have a skin, so you peel that off. But for apples, if you buy them, they should be washed. They should be thoroughly rinsed and washed. And the good news is it doesn't appear that the virus lives out of the body for an extended period of time. So if there's a giant bin of apples and it's been there for hours and you put a few in a bag, you should wash it to get all of the microbiologics off of it. But I don't see that as a particularly more dangerous situation. What would be is if the person that's cooking your food has a runny nose or a cough while they're doing it and they're serving it and they hand it to you and they hand you the apple and it goes right in your mouth and you still have droplets on that apple. So again, it all goes back to isolating and keeping away the people who are sick from getting you. But yes, I got to tell you, if you ever see me in a supermarket by the produce aisle, I want to buy it, but I'm very just nervous, you know, edgy. But it's a reality, and wash your fruits and vegetables, all of them. And that's from beyond coronavirus. Honestly, I'm more worried with fruits and vegetables about Salmonella and E. coli and other things.
Understood. In terms of, and I know you had mentioned school programming, you know, I guess sort of large assemblies or large meetings. Is that something that at this point we should be avoiding, or should we still be going through with with those?
So I've been asked that question probably 100 times in the last 2 days, and the answer is, as an evolving situation, it has to really be evaluated on a case-by-case basis. We have many Nassau communities, many, that have not had one case of coronavirus. Many. In fact, 6 of the first 7 cases were all within the same network of people contained. So if we have communities where we don't have cases of virus, maybe somebody who's at risk or is elderly or immune compromised may want to stay home, but I don't think all events need to be canceled at this time. If there's a localized situation where there's staff and students within a school, then that community and that school board superintendent may make that decision, but I would not across the board recommend canceling everything now. It really is not to that scale yet, and that is way down on the layer list of these non-pharmaceutical interventions. So I wouldn't just routinely cancel something unless there was a known risk and reason to do it. We don't cancel for when there's a flu, in the middle of flu season, we don't cancel school plays and all that, and that's, I think, but we're happy to discuss individual events because I understand the concern. You're going to start to see some things be canceled. So my daughter's in a school play, and she was telling me that before the play, they go to a nursing home and do the play for the seniors. You know, if that's something that would be on my earlier list to say, maybe that's not a great idea, just because the kids who might just be a little sniffly are still going to do the play could present maybe a risk to the people they're presenting to. So that's an example where you have to evaluate it. But as a whole, we're not at a point where I would say, just start canceling events. There has to be a reason and a risk behind it. And like I said, most Nassau communities don't have one case. And so in those communities for now, they should have school and they should have sports and they should have events. And Might that change? It might. The other thing I want to mention, as far as closing schools, which I understand might one day become a reality, and other countries have done it, evidence has shown that closing schools isn't a great mechanism on these curves, because when schools are closed, kids aren't staying home isolated. Parents still have to go to work, and so other people watch kids, and kids still need to have some kind of social experience. And so closing school, the act of completely closing schools, while it may be necessary, doesn't have the community impact that, say, keeping seniors away from an event might. And I think that's an important point. So there's a lot to this, and for events, I would respond that it really should be evaluated on a case-by-case basis. In parts of the county where there is no disease, and that could change any day, but if there is no disease and there's no risk to the school per se, have your event, live your life, take precautions. If kids or adults or teachers are sick, they need to stay away, and there has to be ability to wash hands. But if there's a school district that becomes inundated and there's a lot of people out on quarantine and a lot of people sick, we might make that kind of recommendation.
Okay. So we shouldn't be concerned at this point having a meeting of the legislature? We're okay?
I'm not saying anything.
I do have a couple of, obviously one of the reasons why we wanted to have this hearing is to see if there was anything you needed from the legislature, anything that we could provide. I know that obviously based upon your current staffing, your staff is working overtime and is doing everything that it can. You know, I do note that in 2019 you had a budgeted head count of 175. You had requested 10 additional people for this year. Your actual budget had been cut, instead of an increase of 10, had been cut by 8, which we had put in budget amendments to restore, but those were then vetoed by the county executive. So right now it's a swing of 18. You had asked for 185, and now based on math, you're down to 167 as far as I can tell. Do you have adequate staffing right now to be able to meet the challenges that you have to face? I know you've mentioned, for example, that some of the voluntary checks that you were doing early, obviously those are going to have to be discontinued because you simply don't have enough people. Is there anything that we can be doing in terms of getting you additional resources or getting you additional staffing so that you can meet the challenges that you have to meet?
So to be fair, and I appreciate the question, and I appreciate the support, to be fair, as this has unfolded, everything I've asked the administration for, I've received as far as support. We have a Medical Reserve Corps trained of over 1,000 volunteers who we can call on for help. This isn't going to be a health department alone event. You know, Commissioner Morelli is ready to help us, and if it grows to a certain point, we may have to relocate out of the health department to OEM, for example, where other departments might help us. We've needed the support of mental health because during quarantine, sometimes people need mental health evaluations, and that's done through their agency. Police is always a big partner, and we may need police, we will need police to help us with, people who violate quarantine. State Health Department has given us resources that have come down, and I'm watching very closely what's happening in Westchester, where they've got I'm not sure of this. I've heard this through the grapevine. They've got in the thousands under quarantine. So their health department's not bigger than ours, and they're finding a way to do it. I'm in touch with my colleagues, and I spent a day in Albany yesterday in the middle of this, speaking with all the other health commissioners and directors about how we're going to get through it. So far, we've been able to do the work, and we are prioritizing as a health department, and I think that's important for everybody to know. The health department does a lot of things and provides a lot of services that everybody's comfortable with and enjoys. And now we are pulling all of our resources to this and other vital things. We're not stopping the other work. We're still testing water. We're still making sure there are other diseases that outbreak. There might be a hepatitis case or an E. coli case. Tuberculosis unit keeps working. STD unit keeps working. Inspections will continue. But we are focusing on the highest risk and most impactful to life events and work that we do, and that's what we're going to be prioritizing with the resources that we have. If it's true that it gets to quarantine numbers like Westchester that I've heard in the thousands. We're still going to do what we can. The key is we are able to do the contact investigations and the mandatory quarantine. And I believe with the assistance of our agencies and the police that we're going to be able to do it. And I do want to repeat, throughout this, any resource I've asked for, I've gotten without hesitation, and I'm very appreciative of that, and I'm being honest about that, and I think that we'll be okay with that.
All right, and obviously, if that situation changes, I think I speak for all of us, just let us know.
I will, and I'm not, you know me a long time, I'm not shy. If we need it, I'm very quick to ask, and yeah, I just, what I do need and I appreciate is a lot of you have reached out to me, and I want to get back to you as quickly as possible. Just give me a little bit of time. That's what I really need, because, like, right now, I think there's probably been 40 texts of elected officials, school leaders, et cetera, and I can't just stop and speak to them. And that's what we're up against. We're up against trying to respond to everybody and provide the guidance. But I'm so proud of my staff that I've not heard complaining. They've been working around the clock on weekends and nights. Many of them have little kids at home who they're not seeing. You know, for me, it goes with the job. I expect it. But this has been a challenge, and nobody's complaining. They understand this is life-saving work, and this is why you have a health department. This is our time to shine, and we'll never be able to quantify how many people don't die because of our efforts, but people will stay alive because of our efforts, that's for sure.
Thank you, Commissioner.
Yeah, thank you.
And we appreciate your efforts, certainly. I do have one question for Commissioner Morelli, if you don't mind. Just in terms of you know, and of course you know my personal interest in it. In terms of the volunteer fire service, I know that, all right, I caught wind that the city, for example, is changing its protocols and its response protocols in terms of not sending firefighters, for example, to back up and assist on a call for a suspected someone who's exhibiting the symptoms, possible symptoms of coronavirus. Have we been issuing any similar protocols, or is that really up to a department by department response?
Well, one of the concerns is the number of people that we send in, and, you know, again, being in the volunteer fire service, sometimes the ambulance is like the clown car. By the time it arrives at a patient's house, 6 people are piling out of it. Our concern is not having that. Some of the information that we're releasing through the regional council and through the Association of Fire Districts, as well as through the individual battalions, is to begin to limit the number of people that you're sending into calls. Nothing has been written as of yet as far as a protocol goes. I've been in touch with some of the folks from the regional council, and it's not a matter of me, you know, trying to stay in my lane, but I spent 35 years with the FDNY as a paramedic, so I do understand the information and the ramifications. We've been doing what we can, and in personal conversations, to do just that. Limit the number of people that are approaching patients. Heed the advice of the call receiving operators from FireCom and from the police department as well. One of our concerns is the fact that there are 34 other dispatch agencies for volunteer fire departments and ambulance corps that may not be getting the message. So the Association of Fire Districts, as well as the Fire Commission, is trying to put together some information so we're able to get the same message out to everybody. And one more time, as we are able to, we're going to be providing additional personal protective equipment to all the volunteers, as well as some of the local smaller law enforcement agencies from some of the towns and villages, so to make sure that everybody is protected during this. Going forward, though, that's a message that I believe it will be coming from the regional council to all of the agencies.
Thank you, Commissioner. And same question for you, and this is the last one, as with Commissioner Eisenstein. Is there anything that we can be doing as a legislature to assist you in what you have to do?
I apologize. Thank you. Again, the administration's been very kind in getting us anything that we need. Gratefully, our needs have been small at this point. The only thing that I want is for people to, as Dr. Eisenstein and as everybody else has been saying, you know, we understand the need for diligence. If everybody manages themselves, we shouldn't really have that big of a problem. Hand washing, make sure your children are washing their hands. I agree with you. I'm sitting here, I'm waiting to write on my face because I forget to close my pen. I'm trying not to touch my face. It's just a matter of everybody heeding the warnings. The hand sanitizer, if it's out there, that's great. If your hands are not soiled, use hand sanitizer. There's the price gouging, and there are other issues in attaining it. We attempted to make an emergency purchase, and while we were on the phone, the vendor we were dealing with went from 1,000 to 0. So it's running out of here. I'm looking at it from a different perspective. Eventually, everybody will have it. So it's going to return to the shelves. If everybody just heeds the social distancing, make sure that they clean the surfaces, and most importantly, they can't say it enough, if you're sick, stay home. There's no need to go out, which is one of the points that we're doing with the entire continuity of operations planning. Should there be a number of people within your own departments or with your own agencies, stay home. If the office needs to be closed, we're working out issues with the IT department and getting people VPN access so they'll be able to work from home. Other issues aside, government still needs to function. So whether it's here, whether it's the legislature or the towns, villages, there's 69 different hamlets, towns, villages, and cities. We need to make sure that everybody is up to continuing their jobs.
Thank you, Commissioner. Thank you, Madam Chairwoman.
Legislator Drucker.
Thank you, Madam Chairwoman. Dr. Eisenstein, Mr. Morelli, thank you very much for your presence here today and your information. Very helpful. Dr. Eisenstein, every year we get a flu shot, or some of us get flu shots, and even though we know that the flu shot really protects us against one particular strain of a flu virus, is that correct? There are still, every year, thousands of people die from the flu. And I just found out recently myself that the coronavirus has been around for quite some time. But the novel coronavirus is what we have now, what we're facing, and that's a very different type of situation. But I mean, in past, I've been in a house where someone has had the flu, and I never got the flu. This particular type of strain of the coronavirus is completely different than other forms of viruses that we are always concerned about year after year in terms of protecting ourselves from the flu. Is that correct?
It's new, it's different, and we haven't really studied it yet to know exactly the answer to your question, but all respiratory viruses, some of the precautions work for all of them, and that's what we're preaching. And we hope there'll come a time when there is a vaccine against this strain of coronavirus. A surprising number of people in the population don't get flu shots. It's one of the things the health department, do you hear me? I scream about the flu 12 months a year. It's never too late to get your flu shot, and if it is, it's time for the next flu shot. There are a few strains covered. There's an A and B strain covered annually in the flu shot. It's usually a decent match to what's circulating, but not 100%. But the flu shot saves thousands of lives. The last I heard, there were already, and this was old, this is a few weeks ago, there are already 12,000 deaths in the United States this year due to the flu, and I know 9 pediatric deaths. The overwhelming majority of people who die from the flu were not vaccinated. People who are this year we did see, especially in kids, people who are vaccinated still get the flu, but they had very mild cases. And so even when you do get it, because the vaccine didn't take 100% protection, it provided enough to keep a lot of people alive, and that's what we're trying to achieve. So I think we need to see, I came up with an analogy, I don't know that it exactly applies, but I think it's kind of, I just made this up, so this is not evidence-based, but when people say, what do you mean I've come across coronavirus, but this is different coronavirus? And the way I thought of it is, imagine a little dog, imagine a poodle that, there's a poodle and then there's a German Shepherd. And the damage that one could do to you is very different than the damage the other. They're both dogs, but they're genetically still different. And that's the way I would kind of present this to you. The other former coronaviruses cause a common cold, the way maybe, I'm not sure that this is not a time-tested analogy or scientifically proven analogy, but it just shows you that within a certain species, within a certain animal, there could be different levels of danger. And that's what I'm trying to illustrate with this, is that The other coronaviruses, everybody here has had a coronavirus. They're very common. They spread and cause the common cold, and almost all of them people do well. With this one of the main, I didn't talk about this before, one of the main complications that causes death with viruses is pneumonia. And flu can cause post-flu pneumonias, which is a source of death in many people. That particularly occurs with people who have respiratory conditions. I've anecdotally heard that a lot of the cases around the globe had diabetes or high blood pressure or another contributing factor as well. But we're learning this now, and I would just urge caution until we're comfortable saying, it's just another respiratory virus that unfortunately is more severe for a few people. We don't know the epidemiology yet. We do know it can be deadly, and so we're trying to keep people alive.
So does that really explain why, I mean, we've read that the governor, there's a sense of urgency to try to come up with a vaccine for it. But is it that concerning that we should, do you think we'll have a vaccine for it, or is it just something that, like other forms of virus, it's going to, with proper precautions, it'll run its course and maybe die out? But is there really a sense of urgency for us to come up with a vaccine?
Well, I think there is, and the reason is if you look at mortality rates, when you even, let's just take 1%. 1% of our population is a lot of people. Now, not everybody in the population would contract disease, but even if 10% of the country, and that would be a low guess for a brand new virus with no immunity. If 10% of the I don't want to do the math, but 10% of 350 million is a lot of people, and 1% of that is still a lot of people. And so, you know, what we want to make sure, it goes back to the curve that's up on the screen, is that we limit the number of people who are exposed and limit the number of people who will die. We know some people will die. It's already happened in Washington and state and others. I'm very appreciative and thankful right now that of the first group of people that we know who had this, none of them are critically ill. But this is life-saving. I want to be clear. This is a virus that has caused death around the globe, and that's what we're trying to minimize. And if it were just another common cold, we don't like to see the spread of any disease. That's why you have a health department. But certainly I think the potential, and we're managing expectations. This is unknown. Part of the panic and fear is because of the unknown. We don't know what this is going to lead to. We've been trained by Hollywood that viruses are going to come and cause all kinds of damage, but that historically has happened. The flu of 1918 ravaged the earth. It killed millions of people around the globe. We're going to do everything we can to limit the damage here, and that's what community mitigation, that's what we're trying to do. So I do think it's prudent to try and protect especially the people most at risk.
Thank you very much.
Yes.
Legislator Lafferty.
Thank you, Madam Chairwoman. Commissioner Morelli, thank you as always for your service. And Commissioner Eisenstein, you're making us proud these past few weeks on TV, and I just want to say thank you in the midst of the chaos for taking a phone call from me on a constituent issue unrelated. You've been unbelievable.
Thank you.
Not a question, just more of a statement. Obviously, with the fluidity of information, the public's relying more and more on press conferences and mass media communications. My ask is to please remember, not just for both of your departments, but for every county agency, the first law I wrote, unanimously passed by this body, is to have a sign language interpreter, a qualified ASL interpreter within view of the camera at those press conferences. So please, as we continue to rely on these mass media communications, please make sure we have those in camera. And anything you need from my office and for this body, we're here to help.
I agree with you there, and there was an interpreter upstairs this morning, and the irony of it is we had an event on Saturday that was too short notice. I reached out to our friends over at Mill Neck, and they've been spectacular. Every time we request them, they're there. Saturday was unfortunate because I gave them 89 minutes of lead time, but we're doing everything we can in that respect because we do understand that population also needs to be informed.
Thank you.
Legislator Bino.
Thank you, Madam Chair. Good morning. Dr. Eisenstein, I'd start out by asking, what is the protocol for communicating with school districts relative to mandatory quarantines?
So I met with all the school superintendents, and we went over the protocols. The protocols have changed. They changed on Friday since that meeting, which was about a week and a half ago. We are going to first assure that the people who need to be quarantined are quarantined. Making sure that they are kept away from the public is the single most important thing, and doing it in a timely fashion before they get to the building. Once that happens, we will be notifying the school that students won't be coming to school. We have to be very careful with regard to privacy. Somebody being under a quarantine does not make them sick, does not make them risk. Now, the discussion we would have with school districts would be very different if a staff member, a teacher, a bus driver, whatever, had the disease and had been exposed. Then our contact investigation would actually go into the school, and we would work with the school to try and identify, I don't know, who had lunch at what time, or who was on what bus, whatever the circumstance might be, or who was in that science class, whatever it might be. So schools are not part of the contact investigation unless the disease is within the schools, but certainly if a student is going to be out or a staff is going to be out, we would want the school to know, so that schools have been asked. There are going to be students who are kept home. Schools have been asked to make an accommodation so that the students are able from home to do some of the work so they don't fall behind, and we will keep them informed. Very often schools want information, private medical information that's not relevant to them and not part of the story, and we won't give that. We will protect student privacy. What we will tell the schools what the risk is to them and what the suggested measures would be, and ultimately the schools make their own decision on whether to stay open or not.
What would be the time frame, though? And so let's say, for instance, someone was notified yesterday, mandatory quarantine.
Yeah.
How would you contact, what would be the time frame to which you would contact that school district Monday morning?
So everything is done on a prioritization basis. There isn't a set time limit. We will get to them as soon as possible. But making sure that whoever is not going to the school is situated safely is going to be the priority. Telling the school will be important, and we will let them know as soon as we can. But first we have to secure the premises and make sure that people are in a safe condition. Then we will notify the school.
I understand that we have...
If there's no risk to the school. That changes. That's a totally different story if there is a risk within the school.
I'm just sticking with mandatory.
Yeah. We don't have a set, there's no within 1 hour or 2 hours protocol. We're doing it as quickly as we can.
I understand, and I know you're under extreme circumstances here, but wouldn't you think it would be a good idea for us to have some level of protocol in place so that it's not a step that gets skipped in the process?
Well, I don't think it's been skipped.
I'm just asking a question.
Yeah, I think that we are thorough in our work, and I think that to commit to something that an emergency might pull us away from, I'm unaware. It's part of what we do. It's not necessarily, stepwise. There isn't that says, okay, from the time a child's notified within 2 hours, we're going to tell the school. But we are going to tell the school. We are working with them. And so I think it is part of our protocol, quite frankly, already.
I was just trying to understand a timeline.
Yeah.
Is there a process? Is there one person in your department that's tasked with making that call? Is there some level of a protocol?
So we have a team. The team is in. There's an incident commander, and people are assigned to different cases. If you're talking about on the weekend, we have people come in and people cycle out, and we have to make sure our team gets rest. And so there isn't just one person the whole time, but we do have a large team working on this, and the communications have been really good. I understand, and part of this is managing panic. I understand that people hear a lot. Sometimes even on Facebook I see wrong information that's passed around, and somebody calls me and says, hey, have you read this report? And I look at it. We want to make sure that the information that we give is appropriate, and we want to make sure that we have answers and we have recommendations. And when you call a school and say, so-and-so student is going to be under mandatory quarantine and they're not going to be coming to school, the discussion doesn't end there. That always leads to whole other questions. Well, what actions should we take, and who else were they exposed to, and were they on the school bus, and who is it, and are they sick, and what's their condition? We have to make sure that we have appropriate information before we communicate. We have to make sure that we're available to protect a student, or it's not only student, staff member, whoever it is, and we take that very seriously. But in my assessment, not everything has been perfect. This is an emerging, rapidly evolving situation, but I think my team's done well as we can do under the circumstances. And look, just this morning, we're talking about 8 new cases since I walked in the building. The team's working on that. I don't know what it's going to be by the end of today or tomorrow. We're going to try and keep everybody informed. And I think the most important thing I could say is the measures that we're taking as it actually comes to protecting the community are immediately addressed. Notifications, we're doing the best we can to keep up with it, to make the school aware. If the school is at any risk, that is an immediate phone call. If the school is just being notified somebody's not coming, it's hard to find some people on a Sunday evening, so we might wait till Monday morning to let them know when the administration's there. Now, most school administrators are responsive 24 hours a day, to be fair. But it certainly is, that's an easier task to notify during school business hours. We also have a much larger staff, perhaps on a Monday. But we had a full unit this weekend. A lot emerged very rapidly, and I was very proud of how they did.
So thank you for that answer. I was contacted throughout the weekend, so I know your department was working, and I definitely appreciate all the efforts. Just wanted to know about the protocols, and if, as we move through a process, I understand, things will change. Yeah. And I'm hopeful that we will create protocols as we move through these different events.
Absolutely, and we do have plans. We do have plans in place.
Okay.
There's unique circumstances. A plan can't address every unique scenario.
All right, so you talked about the 516-227-9570 work line. And it's open from 9 to 5?
7 days a week.
7 days a week.
Yeah.
Is there any intention to extend those hours, especially as it would relate to being able to be in communication with school districts? We know that most school districts are open as early as 6:30, 7 o'clock in the morning. If there was staff that was available to answer those calls very early.
So we do have nurses in that early.
Okay.
But they're not part of the call center. The call center is for general information. Any medical scenario is going to be handled by the team. And the team is available 24 hours. We do have an after-hours number. 24 hours a day we can take calls, but routine calls we want to happen during the day when
that 24-hour call is.
We have an on-call. We have an on-call for medical concerns.
Okay.
Not for what's general questions, and we don't want to use the middle of the night for general questions.
Can we make sure that every school district has that number,
yeah,
please?
Absolutely.
Thank you. So what has been our communication to our staff? I know we're generally telling people stay home. Has that been communicated directly through the ranks of Nassau County's employees?
Yes, I believe a letter went out from the administration last week, and through HR, I've gotten a million emails. I'm trying to remember which is which, but we have, we want people to take precautions, but even so, business continues and serving the public continues, and especially for the majority of the percentage of our population, they've not been exposed to coronavirus or anywhere near it. So we want our staff to be aware of what's happening, and at the same time, use common sense precautions. We want to make sure that people know to wash their hands if they sneeze, to wash their hands, stay home if they're sick. That messaging has gone out to our staff.
Okay. And are we taking any additional protocols in terms of staffers that would be entering homes or that are working with our jail population?
So PPE training is part of all EMS response, all of our responders. We try and limit exposure, things that we can do from outside a home, like talk to somebody on a phone but see them in the window, we would do on certain occasions. Our health department staff is trained, and our medical reserve corps is trained on the proper PPE. There's plenty of supplies, as Commissioner Morelli testified before. And EMS goes through training. I'm not part of that, but I know they go through training, and our hospital partners are excellent. We have had to arrange a couple of transportations over the course of a month, and that's been done appropriately with the proper measures in place. And I'm comfortable that protocol and that we would not send somebody into a situation that was not safe. And we're with the police commissioner, had a press conference earlier this week showing the different masks and the different materials and the equipment and the training that they have. I believe there's a press conference later today out somewhere. Where's that? Malvern, about infection control and transport and the like. So certainly keeping our own staff safe is our top priority. If we don't, and even within our department, if somebody's sick, I don't want them there. The worst thing that could happen is our department gets hit by something that takes a lot of people out. So there's so many of these bottles in our command center right now, but taking care of our staff and making sure we cycle people in is concern number one. We can't serve the public if we're unable. We got to take care of ourselves so we can take care of the public.
So, again, I just want to close by saying thank you for all that you're doing collectively, all of the county agencies. Commissioner Morelli, appreciate you. Thank you very much.
Thank you. I just want to ask one quick question before we have 4 other legislators that want to comment or have questions. But what are we doing in particular? I know we've talked about all our departments, but over in our correction facility, what are we doing to make sure that they are covered? I know Legislator Birnbaum did ask, but, of course, their population changes constantly, and also the workers there.
Yeah. So the question had been raised, and I know we're working on it, of should there be screening for visitors, screening for employees. And look, we know that that's a high-risk population. Staff there, what we understand, is doing an excellent job making sure that they're practicing sanitary protections. And the guidance is the same, routine cleaning. Routine cleaning is important. But I think the most important thing is sick people staying away. It's the same theme that I'm saying for every aspect. Whether it's a school or a senior center or a jail, the key feature is sick people staying away. I don't know if the sheriff has any plans to change visiting hours or anything of that like. I do know the question is being batted around about doing temperature checks on visitors. I don't know what will happen with that. But it comes back to the same measures. People who are sick, whether they're visitors or staff, should stay away, and that's true for schools and jails and senior centers and hospitals and restaurants and every aspect of society. The measures aren't different, although we do acknowledge that the risk and the potential exposures varies in different settings.
I just want to make sure they have all the supplies, too, that they need there, in that facility.
So far, no requests have been made to us for any supplies at the correctional center. We did receive a request from the juvenile center. The population there is low. I believe the census is only about 16 individuals that are there. We are making arrangements to get some supplies over to them. From what I'm told, and I'm just reading a text about concerning this, their facility was sanitized over the weekend by an outside vendor, but that does not negate the fact that there could be somebody there that's still ill. But we will be providing, they should have picked them up this morning, some masks and gloves for those over at the juvenile center. And from what I'm told, at the correctional center itself, they do have their own on-staff cleaning people, and both the correctional center and the juvenile center are screening their visitors with respect to travel and any of the risks that they're getting. It's a pretty informal question and answer back and forth when they come to visit. Has there been travel? Has there been anybody at risk? So they just want to prevent it from coming in also. But as I said, the correctional center hasn't requested anything. The juvenile center has, and we are providing for them.
And we will make sure we keep in contact with them directly.
Yes.
Okay. Legislator Birnbaum? Oh, were you next, Legislator Carrie Salages?
Thank you to the Madam Chair for allowing non-committee members to ask questions. Thank you. Good morning. Good morning, Commissioner. Good morning, everyone here today. I'd like to thank you very much for putting your department in overdrive and working beyond 9 to 5 and really coming to the call of duty and helping our great county. Thank you very much.
Thank you. And overdrive is the right word. That's the perfect word, actually. Thank you.
I hope you're eating your Wheaties and taking your vitamins. We need you. When you succeed, we all succeed.
Thank you.
So congratulations, and thank you for your hard work. I was informed by several parents from a local school district in the community that I represent that there were students who came back from Milan and a teacher, and they were under, sick. They were sick and they exhibited other, one student had pneumonia. And I understand that they reached out to your department and you went above and beyond and you answered their questions. And the test came back negative.
Thankfully,
and
yes.
Okay, and I'm very thankful for that. Yeah. Now, I'm put in a position to either inform my community that there was this scare and that everything turned out to be negative. I would ask you, if you were in my position, would you issue a statement informing individuals that this occurred or not issue that because it could increase fear and unfortunately people acting in ways that are not reasonable?
So it's all based on the risk to the community. So if people were traveling back from Europe and were never in the school per se, there is no risk in the school. It's only the travelers who could potentially be at risk. I would protect the privacy of the travelers because everybody in the school is going to know who the travelers are, and you have to be very careful not to identify somebody in their health condition. If people came back sick and went to school, and so there's a fear that there's an exposure in the school, that would be something we'd be happy to discuss with you and assess the risk. But so while we're sitting here, I got a text from somebody that one of the school district doctors who said, the school district just called me. They were called by the health department that one of the students is on quarantine. They're not allowed to come in, but they're not sick. Should the school close? Well, that student was never sick. There was never an exposure in that school through this student. So, no, the school shouldn't close. Should the school make an announcement? The school can announce what they want, but what are you announcing? That there's somebody who's not sick? There's somebody who's not sick, but we're keeping them home just to watch them. There's going to be hundreds of people on quarantine in the next few weeks, hundreds, maybe more. I've heard in Westchester there are thousands of people. So it will quickly become a lot of people who are asking to stay home. And if you think about it, that it's your unique situation that you describe is a unique one case, but there are hundreds of variations of that. And so I think it really has to, my answer to you is it really has to be done, I'm touching my face, on a case-by-case basis based on the risk to the community. People want information, but very often they want information that they're not medically entitled to because it's somebody else's private business, or they want information that's not actually real. They want to hear there's this and there's this and there's this, and when you say there's really not, they're disappointed. They want a story. So I think we have to be very careful to not panic the community, keep them informed of the facts, and whenever there's a risk that people need to know, that's when we make sure we inform them. I don't know.
Understood.
Yeah.
My next question, has the health department or the county executive issued any directives to the bus service, NICE bus service, to clean their buses? I've seen, again, in New York City with MTA, they've been doing a lot of work in terms of cleaning the subway terminals. Are they cleaning the apparatus on the bus where people put in the card?
That's a fair question, but that's a question that would be for the administration. I know they were talking about it, but I wasn't in the conversation, so I don't know what was said or not, so I don't want to comment.
Understood. Nothing further. Thank you.
Thank you.
Thank you for all this information that you have provided to us. I know a group of mothers who have children with asthma, and you said children are seem to be less susceptible to
So
this
far, it
particular
seems
strain.
that way.
So what would you say to these mothers, because they are really fearful about their children since their condition already is?
I think in a case like that, it really requires, each case is different, and I think they really should consult with their pediatricians on that as far as what is the risk, is it seasonal asthma, what are the triggers for asthma. I have not seen, anecdotally, I have not seen a published link to asthma and this disease, but there might be that I just haven't seen. There are many publications coming out very rapidly. I'm trying to stay on top of all of them. So I don't want to make a general statement about that. I'm not a pediatrician, and I think that we have enough pediatricians here in the community that can guide these families through it, that I would recommend the phone call to a pediatrician and say, are there any special precautions? Certainly, we don't want anybody to be sick. We're happy that it appears that children aren't suffering as severely as adults, but that doesn't mean they can't. And certainly there are children who are immune suppressed, and we don't want them getting sick. So the message to stay home does apply to children as well. When a child is sick, please don't send them to school. There are other children who have asthma and who have other immune compromising situations. And so it's very easy that a kid gets sniffles and you send them to school. We're asking parents not to. Excuse me.
Okay, I'd also like you to address these new testing kits that Northwell Health has, and I think the testing, the result period is supposed to be shorter than previous tests?
Well, it's shorter because the test doesn't have to take a 3-hour car ride to Albany and then wait in line. But there was one lab doing the test from all over the state. So now it's a 10-minute car ride, and hopefully they're able to batch and give results out much more quickly. So I think what you're seeing is an increased capacity to do testing. Wadsworth Lab in Albany and CDC Lab in Atlanta were really our only two places to do it. Now we have the Northwell System Lab is doing testing, and I've understood that commercial labs will be up and running in the next week, maybe 10 days. So the capacity to do labs and get results back quickly, which is a key part of this, find people and isolate them. The timing should be much better. I don't know the specific kits themselves, but it's taking less time just because we don't have to get a sample 3 hours with traffic 4 hours up to Albany.
Okay, and when would somebody actually be sent for a test? Like, who makes that decision?
Okay, so that's a really important question. The national capacity to test is still limited. And while the new guidance allows any physician to order a test, which is new guidance, there's a couple of asterisks that I think are very important. First, if a doctor chooses to test somebody hopefully because they have symptoms that would match, and they've ruled out other things, there still has to be a cause to test somebody. This is very important. Anybody who gets tested because a doctor is concerned that they have this is automatically going to be entered into mandatory quarantine. That is the state's protocol, brand new protocol. So we don't want doctors just doing it because people want it or they have a cold and they think they have it. There are symptoms and history that have to be evaluated, but in the near future, as the capacity expands, any doctor will be able to order the test. But they're going to have to report it to the State Health Department and to us. And if they've ordered a test on somebody, that means their suspicion is high enough, and we're going to put that person into mandatory quarantine while the test is pending. So as of now, the capacity is expanding each day. When Northwell opened, I believe I had read they were able to do 75 or 100 a day, and their hope was to get up to 1,000 by the end of the week. We have 1.5 million people here. 1,000 is a very small number. But doctors, providers, whoever's ordering the test, and patients need to be cognizant. We want to find people. We want to appropriately use the resources that we have. We don't want to abuse it. And if you're tested, you're not being put under mandatory quarantine as a punishment. You're being put under mandatory quarantine because you're considered possible enough to have it that we don't want you spreading it in the community. So I hope the public will understand that, but that is a key part of this process.
Of course. Okay, so that's the follow-up is mandatory quarantine. How do we actually monitor it? Because that was...
We go to their house.
You go to the house.
We go to their house. We make sure they're there. We check their temperature. We knock on the door and say, "You here?" And we will be going to everybody who's mandatory quarantine. So when I say it's all all hands on deck. We'll have inspectors, we'll have people from other agencies and government doing this. We'll have volunteer Medical Reserve Corps people doing this. We are going, people who are under mandatory quarantine, it is the governor's instruction that we go and physically check that they are there.
So when you say we
Health Department,
being
Health-
your health department, you have people who are doing this.
This is going to be, we may need multi-agency help, but yes, the answer to your question is yes, we have people that are going to be doing this. Some of them, we have a lot of field workers. Some of them are going to be inspectors who, if there's a restaurant and that they have to inspect and there's a home 2 blocks away, we're going to do one trip. They'll do one and then the other or vice versa. So we're coordinating all of that, which is why monitoring, this goes back to when we put people in mandatory quarantine, we want to put all of this in place, and go forward. But so that's the answer. We are going to check that they are complying. We're not going to be there 24 hours a day, but if we see or it's reported, they will immediately be taken by law enforcement with a mask appropriately to a quarantine, a legitimate, locked up quarantine.
So you actually are going to be able to follow every single person who will be tested, that means, because everybody who's going to be tested is being put into mandatory quarantine. That number is going to be...
Yes, but I do want to point out, most of the people being tested are in hospitals, so that's why they're sick in the first place.
Right,
they're in
but now
hospitals.
that there are more tests going
Correct.
to be available, many more people are going
this
to
is
be
work.
tested.
This is overdrive. This is overdrive. That was the perfect
be-
word. We understand the scope of what we're dealing with, which is why I said this has been a massive amount of work around the clock. But we have a very large Medical Reserve Corps. We have partners in other government agencies who are already contributing and helping out. The whole health department knows that the routine things that we do, the processes are going to be altered a little bit. Everybody's going to, I just gave you some examples, but we have this model.
Right, but when they get a negative test result back,
If they get a negative test result back, let me remember the algorithm. This just came out.
Okay.
We're still going to keep them in quarantine for a set period of time if they were exposed to somebody who had disease. That's the thing. So if somebody's sick and we get a negative, but we have no known exposures, they wouldn't have to stay in a mandatory quarantine. I think I got this right. I don't have the algorithm in front of me, so if I'm erring, I will correct it. But if somebody was exposed, family member in the house, we test them today and their test was negative, they still might develop this in 2 days. So based on their risk factor, they're going to stay in quarantine.
so do you know the percentage of false negatives? Or, does that mean they didn't actually have enough symptoms to test positive yet?
We're learning about the shedding of the virus. It's brand new. I don't know how many days in is the test positive. I don't. So that's why we're really figuring out the exposures and basing it more on that than anything else. But again, if somebody's in a hospital, isolated in a hospital, we're not serving them quarantine orders. They're fine. And that is the majority of the people who are tested.
Well, these people are already very sick to warrant going to a hospital,
Sure.
I would imagine.
Yeah.
Otherwise, you would think you might just have a cold
Yeah.
or a cough or...
Correct.
Okay, my last question would be the hand sanitizers,
Yes.
the Purells. Okay, I just recently got one, never had been opened, but I just was reading the ingredients, and then I saw it has an expiration date on it. So what if it's a year or two past the expiration date?
That would be very, very old because I know at least a 2-year expiration date on these.
Yes.
So then what we do in emergency circumstances, what I would say with medicines is, don't throw it out. See if you can get one that's not expired. And if you can't, it's better than nothing. It's not ideal. It's not indicated. But if there's such a shortage that all you have is one that expired last month, I would still use it. That's an off-label use. I have to, clear. Yes, the specific circumstance, but that would be better than nothing. If it's 5 years expired, I don't know what the efficacy of it is, but it's the alcohol-based rub.
Primarily alcohol,
Yeah,
right?
60% alcohol is what you should be looking for. Doesn't matter who the maker is. Doesn't matter. 60% alcohol is what the indicated is. And if you look at them, this one doesn't say, does it? It's the writing so small I can't see. I can't even
I mean,
say.
based
It'd
on
be
what
on
you're
the box.
saying, could somebody make their own home solution using alcohol?
I don't
and,
recommend that. I do not recommend that. And it's funny, a couple of the liquor companies have actually come out and said, please don't use this to make your own sanitizing solution. Yeah. I would not recommend that. I would not recommend
to use
that.
just soap and
People
water.
they don't understand what chemicals or concentration, and, alcohol can be toxic if it's breathed in or if it's abused. I don't recommend people making their own. Rather, they just use soap and water wherever they can. But the supply chain will refresh and just keep people looking, and I could tell you, I've seen it in stores in the last 2 days at regular prices. Not all the stores I went into, but I've seen it. In some places have it, in some places don't, and supplies are coming in.
Okay, so one last question back to the incubation period. So if you're quarantined, is it a 14-day incubation? Could it be 14 days after somebody was exposed that they first?
So 14 days is considered the maximum possible incubation period. Once we've learned more about it, that may change. Once we've studied it and we show that the incubation always ends by day 8 or 9, we might shorten that to 10-day incubation. But not knowing the answer, the federal government, which I think was a wise choice, albeit a long period, picked a number that they think would cover every possible case. So I think we're starting to see incubation periods tend to be in the 2 to 5 day range, but I'm not willing to say there aren't cases that extend out. So 14 days is chosen because it's considered the maximum, at this point with the information we have, the maximum possible incubation period. If we learn that 9 days is the maximum possible, then we'll change but science is, one of the key things about this curve, the lower curve on the graph on the screen, the striped one is what we're aiming for. As you see, it pushes the cases out in time. And that's, you might say, well, we want to end this quicker. You don't want to end it quicker if it affects and kills many more people. You want to give science time to answer these questions. And so that's what happens when you mitigate in the community and push the cases out later. So hopefully, I would think in a couple of months we'll know the incubation period, and we may alter the 14 days. Maybe it becomes 10 days. Maybe it becomes 17 days and we were wrong. It's likely to be less than 14 days in the future, but right now I agree with the 14 days, and that is the federal and state protocol.
Thank you so much.
Thank you.
I'm just going to have Legislator Gaylor because he's on the committee, and then we have Legislator Abrahams and Legislator Millay.
Thank you, Madam Chairwoman. The questions I have are directed to that bell curve, and you just brought it up.
Sure.
How far to the left are we of the bell curve, and how long before we get to the right side of the coming down slope of the bell
We
curve?
are at the very beginning,
Right,
the
so-
very beginning.
So how long this COVID-19 has been going on for about 2 months now?
Correct.
So how long before we see the exponentially, quick increase, and then
I
how
think-
much longer till it starts coming down and this tapers off?
So I don't know the answer to the second question, but we are just now starting across America to see the exponential increase. We went into the weekend with 200 cases and came country and nationally, and we came out with 500 and something in a weekend. So your doubling time is down to 2 or 3 days or 1 day. I mean, we added today, doubled our cases from yesterday, but that's in part because we're testing. When you test, you're going to find more. So you're going to see a sharp rise now because testing facilities are able to test more rapidly. So we're at the very beginning of this. I've heard anecdotally that China appears to have peaked and they're starting to drop, but I don't know if that's because of the drastic measures that exist, and that if they're lifted, it would go back up. But this is not a perfect model. It's just an illustration of what our measures try to do. But we are at the very beginning of this, and now we're starting to see more cases, and there's going to be more cases. I don't want anybody to panic when they see more cases. We're trying to find cases so we can isolate them. That's what we're doing. It's not, the number will go up. That's not a terrible thing. We don't want to see deaths. We don't want to see cases. And remember, all the measures that we're taking, we're not trying to have 0 cases. We're trying to keep as low a number as possible. The the hardest part of being in public health is we can't quantify how many cases did not happen. You can't count what didn't happen. But I'm sure that a lot of cases are not happening because of the measures that we put in place.
Great. I appreciate all that
Yeah.
that you do, as well as Commissioner Morelli, all that you do. Thank you, Madam Chairperson.
Legislator Abrahams?
Thank you, Madam Chairwoman. Just a couple of questions. And first, Dr. Eisenstein, I want to thank you.
Thank you.
Commissioner Morelli and your entire team and staff for doing a phenomenal job in trying to communicate to the public in this very difficult and challenging time. I did receive a question that, I guess, since we're live streaming this,
Sure.
Wasn't too sure if it was through the live stream through my office or was potentially through the live stream that we do through the legislature. But I did receive a message, which I kind of know the answer, but to answer this person's question who took the time to post
Sure.
on our page, I just want to make sure I answer the question properly or ask the question properly. But their question was related to, and I'm reading it verbatim, hello, in light of the coronavirus rapidly spreading, what does Nassau County plan to do about the Jurassic World live show? Does Nassau County have any authority to make a decision to cancel all the upcoming shows? I have tickets for Saturday, but I'm not planning, I'll make sure I'm getting this right. I have tickets for Saturday, but I am not planning to attend. I called the Coliseum for a refund. I didn't purchase insurance. I was told that the Coliseum has made a decision to remain open. Who in Nassau County can speak with? If Hofstra is taking precautions, shouldn't someone make an executive decision to safeguard children? Now, I know you can't answer that question, obviously. And in that interim, to try to answer this person a little bit more clearer, I did have counsel take a look at the county's local state of emergency and suspension of local laws. And per the county's charter, and in regards to this measure, state law, the only way this would be enacted if there was some level of a state of emergency taken on by the county executive.
Correct.
Which would give her the authority to do that, which I don't believe she has the intention of doing or hasn't discussed, at least with the legislature, potentially doing that. There's no other mechanism, explained to this person, that the Coliseum could be closed. We rent the Coliseum, and I know I'm answering the question for you to some degree, but I mean, I guess what I'm really driving at from your standpoint, and it kind of goes into your earlier part of your presentation, is at what point do you believe a recommendation from your office would warrant something of that magnitude? I've been to events at the Coliseum. They draw thousands and thousands and thousands of people. Actually, I was just there last night. There wasn't thousands and thousands and thousands, there may be a few thousand for the basketball championship for the girls and the boys in the county. But at what point would in your recommendation, large-scale events, events that are probably hosted at Post or hosted at the Coliseum, if I'm Joe Q. Public or June Q. Public, and I'm looking at something, and is it 100 cases? Is it 200 cases? What number are you looking at?
So first, I do want to, for the constituent who wrote the question, I do want to let them know that my department has been in touch with Coliseum leadership to go over measures that they can take, including sanitation and cleaning of rails and that kind of thing. So they have worked, they were receptive to us, they understand the challenge. The question that you raised is really important, and I've read reports that all the major sports leagues are having the same discussion. What's going to happen with hockey and basketball and spring training games, and baseball season is going to be starting soon. There are concerts and school sports events. I think if it gets to that point where events of that large scale, and I know the constituent brought up Hofstra, having read their statement, I think they had a specific risk that prompted them to do this. If it gets to that level, that's going to be a larger level decision that I think, the governor's office and our administration have worked closely, and I think there's going to be a big discussion that's not going to be unique to the Coliseum. I think that's going to be something that's got to be policy-wide. We have a bunch of arenas in the area. Now, if there was something localized that might impact the employees at a specific arena or whatever, maybe that there would be a unique circumstance, but I think right now, we still only have 17 cases. The risk of getting this is very low. The risk of getting other respiratory viruses is still much higher. If people take precautions and stay away when they're sick and they're healthy people, I would have no reservation taking my child to the Coliseum this weekend. That might change. That might change. But I don't know what the threshold is of cases. I think we're really going to have to look at the regional pattern for something as big as a Coliseum event to close. But I encourage, you mentioned college, I encourage colleges to assess their risk. They're welcome to call us to be part of the discussion, but make a decision that they think is right. Out of an abundance of caution, as long as there's reasonable thought and science behind it, we would be supportive of decisions. But I myself presently would go to an event at the Coliseum.
Okay. That's good to hear because I just went to one last night.
Oh, I wouldn't have gone yesterday. I'll go to
My next and final question, and first I want to thank all my colleagues. They asked a lot of good questions, and many of them that I had, they asked already, so I'm not going to regurgitate them again. But I do have a question, and as you may know, in my private life, in my private practice, I do regulatory health care. And one of the things I found a bit astonishing, which I don't know the proper answer to this, is that there are very few special treatment units on Long Island, to my knowledge. Understanding the state regulatory, if you remember a few years back when we had there was a big Ebola scare.
Yeah.
There were many Ebola-labeled units to isolate infected individuals. One of which is Glen Cove Hospital, and the other was Winthrop and I believe Stony Brook. There may be a few others, but those are the three. And I'm sorry, and Winthrop, NYU Winthrop as well.
I remember Glen Cove specifically has a unit that's still ready
there
for that because Ebola hasn't disappeared from the globe. Very different disease, not airborne, but. Okay, I remember it being Glen Cove, but I could be wrong.
So it's Glen Cove. It was NYU Winthrop, I believe. It was Stony Brook.
Okay.
So if an individual or any of these individuals of these 17, and I know you couldn't speak on the numbers 8 through 17. You only have knowledge of strong knowledge of the ones the 1 through 7.
Sure.
If any of these individuals are going to hospitals, and I read about. Some individuals appearing at some hospitals that do not have these special treatment units. They're being isolated in conventional isolation rooms?
Yes, and so that's very important. So I know a couple of the original 7 are still hospitalized. This is not does not require negative pressure rooms.
Okay,
it requires isolation rooms, and I know even that is limited, but we have secured, I've spoken with different hospitals, and I know, for example, NUMIC is preparing a floor they're going to empty and have all the rooms would be isolated from the rest of the building should we develop large numbers of people that need to be isolated. And the capacity, I think, of that was like 30 rooms.
So they're treating this virus, they're treating COVID-19 very similar to how they would treat the flu.
Correct,
if it
in a
came into
hospital.
So it's not reaching the magnitude of how they would treat Ebola.
Correct.
When they built these special treatment units.
Correct, and that's such an important point that on the slide, it says allow flu season to end. On the left, under the third bullet, the second sub-bullet down, allow flu season to end. That's because those beds are the beds we're going to need if this were to become exponentially larger. Same beds that you would have used for flu patients who are under isolation.
Okay. I guess the question becomes, people have loved ones in hospitals, and if loved ones are in if loved ones are in ICUs or they're in the hospital and they're in units, whether they're isolation or wherever, and they're in the vicinity of COVID-19 patients, I guess that level of concern was generated and developed, and people became a little bit more concerned that they're already in a hospital, they're sick, they're in the hospital, now they could be exposed to something that can get even worse.
And that's why we are urging, I know I saw one of the hospitals put out limitations on how many people can visit and the like. Hospitals are places where sick people go, and flu is the perfect example that you brought up. You go to the hospital with one thing, the last thing you want is to catch a flu from the person nearby. But our hospitals are excellent in infection control, at cohorting patients when they can. It's not a perfect system. This is another message. I don't know if I mentioned it today, but We don't want people just walking into an emergency room if they're sick, because they could walk into a waiting room with 40 people and spread it to people who are already there because they're sick. And so we want people who are not hospital-level people to not go to the hospital. So if somebody's under quarantine and they get sick, they should call the health department. If they're mildly ill, we'll test them. We'll send somebody to swab them in their home. Let them stay in their home. We want to minimize hospital exposure. Hospitals have done a good job of preparing. They don't need negative pressure or the special Ebola unit for this.
Gotcha.
But more like the way flu is handled.
Okay. Oh, Legislator Birnbaum just asked the question, do they have to call the health department for this test, or should they go through their healthcare provider?
If somebody's not on our protocol, we don't know about them, and they think for some reason they're sick, they should call their healthcare provider, who's welcome to speak with us. The healthcare providers have the criteria from the state. They have the conditions that they should be looking for. If they're on our quarantine list, they're going to get instructed when they're quarantined to call us should they get sick.
Okay. One more thing. I just got another message. Facebook Live is picking up. So, Doctor, you had talked a little bit about, obviously, when you get the flu shot, it covers many different strains of the flu.
Multiple strains.
Multiple strains.
A couple of strains.
And I know a couple of years ago, I got the flu, and I was wondering, I got the flu shot, and what happened? I've been getting the flu shot for the last 18, 19 years.
Yeah.
But anyway, long story short, are there any strains? You said that the coronavirus has been around for quite some time.
Yeah.
Are there any strains of the coronavirus that could potentially be picked up through the flu shot as one of the viruses that the flu shot? So there is absolutely none.
It's like cats and dogs.
It's cats and dogs.
Yeah.
So the strains that the flu shot protects you from are strictly
Influenza virus.
Influenza virus, which there are many of.
Totally different species.
Totally different species. Okay. Okay.
Legislator Millet.
Thank you, Madam Chair. Okay, so I have a couple of questions. I will be brief, but I'm being asked to ask, are there a sufficient number of testing kits available in Nassau County?
I believe so, and they're expanding every day. So capacity was an issue at first because it's a brand new test, but now that Northwell's online, I know they have an increased capacity. They expect to increase every day. And for the numbers of cases that we have now, you know, we're not testing thousands of people. There's only a couple dozen people. I think we have 20 people or so that were pending tests when I walked in this morning. So for the numbers that we have, yes, and by the time we need more, I think the capacity will be here, I think.
All right, and then just to piggyback on something that Legislator Birnbaum said, with Northwell and perhaps the other labs being authorized to do the test, we're talking about the same test. It's not a different test, correct? Okay, I just wanted, that's how I understood it. And will the tests generally be covered by health insurance?
The governor put out an order mandating that the tests be free. Now, I don't know if that's meaning insurance picks it up and there's no copay, or there's no charge at all, or the state's paying for it. But I did hear the governor say last week that there would be no charge for testing for anybody.
Okay, great. At the beginning, you said 40 people, as of this morning, are quarantined.
Yeah.
Is that a combination of mandatory and
No,
voluntary?
that was mandatory.
Mandatory
Now,
only.
some of those people may be the people that ruled in or tested positive. I've been here the whole time.
Yeah.
I haven't seen it, but there were 72, I believe, under voluntary quarantine this morning.
In addition to the 40?
Yes.
Okay. And the mandatory, could some of those 40 people be in the hospital, or is this?
Yes. Yes, they could. And so when they're in the hospital, we're not, the quarantine order applies to wherever they're being quarantined, but we're not going to serve them in the hospital. Before they leave, they would get it.
Okay. And then my final question, this might be for Commissioner Morelli. You mentioned an isolation kit. What is an isolation kit?
Isolation kits are something that first responders and hospital providers have. The kit consists of of a disposable gown, an N95 mask. I believe they also have a surgical mask there with eye protection, covers for your feet, and gloves. It's to be used whenever you're dealing with any sort of an infectious disease you're not certain of. They also use them when you're dealing with large amounts of body fluid, whether it's blood or anything else. So they're able to protect themselves, keep themselves clean, and it's all disposable, so one use and it goes away.
Okay, and I do have one further question, I'm sorry, thank you. The test, is it a nasal swab, is it a blood draw, what is the test?
Now, I haven't actually seen one of the tests, and that's not been done by us, so I honestly haven't paid closer attention to that. I think it's an oral swab and a nasopharyngeal swab.
Okay.
I think that's what it is, and it's a detects virus.
Okay, thank you, and I just want to reiterate what everyone else has said. Thank you so much for all of the very well-presented, nuanced, measured
Thank you.
presentations. This is something clearly everyone's concerned about, but it's what I'm hearing you clearly say is there's no need to go into panic mode, and that if we just take simple precautions, we're going to be okay.
Yeah, and thank you for that. And look, there's going to be more cases. This is going to be a little bit worse before it gets better,
Right.
but preventing it from getting terrible is what we're going to do.
Yep. Okay, thank you.
Are there any other legislators? Then before we open up to the public, I'm just going to ask, is there anything that you need, that you feel either one of you need from us as the legislature that we need to provide you with?
We'll be asking for your help getting information out at right times, and be patient with us. We're doing everything that we can as quickly as possible, and we want to make sure you're equipped to answer constituent questions, and we're here to serve you. That's it.
Well, again, we thank you.
I'm sorry, I agree with Dr. Eisenstein. Just share the message that's coming out. We want to make sure that there's a concerted message and they're not getting any mixed messages. County government's here for you. We're doing everything we can to help everybody else, just as you're doing for your constituency. All I ask is that we share the same message so there's no confusion out there. It'll help alleviate a lot of the calls and questions of everybody else, but they'll also know that they're getting the right amount of help from their legislators, which they can count on.
Well, again, I just want to thank you all, and certainly thank everyone in your departments for their
Absolutely.
dedication. And like I said, I know there's been a lot of sleepless nights that you've had because you've been working, really working overtime. But again, we are here for you too, and whatever you need from us, please let us know. And with that, I don't know if there's anyone from the public that would, I'm sorry.
Yes, I would just also recommend, and I commend you on your fortitude to ensure that we had a scheduled session today. I would just say that if it's possible, on the Mondays we do have committee, if not sooner, depending on how this thing develops, that we at least get an update from the health department going
We'll
forward.
be sending you written updates more frequently, I promise that.
Oh, that would be wonderful. And if you could, possibly meet with us beforehand so that you could give us an update, which then is live streamed to everyone also.
I apologize. I know I'm not on the committee, so I'm recommending things
That's-
to the committee
that's-
that's not on, but I just thought it'd be fruitful to have that kind of.
Information dispersed. Thank you very much. Is there anyone from the public that did want to speak? Okay, seeing there's none, then we are going to close the hearing and thank everyone for being here. Hopefully those who were able to look online got a lot of information, and we will certainly keep everybody up to date on what is happening.
Thank you.
Dude, you got this.
The slide's great.
Yes, it is. I'm looking at that myself. It's a great slide.
Yeah, the state health department. All right, let's head up. Helena's calling, so I'm running.
Yes.
Thank you.
A million calls, too.
Let's go.
They got it, they got it. I guess, I don't know.